Namaste, myself Jayoti, Saxena, Faculty of Physiotherapy and Diagnostics. Discipline is Medical Laboratory Technology. My topic is Trichomonas vaginalis. Trichomonas. Trichomonas offers differ from other flagellate as they exist only in trophozoite stage. Cystatic stage is not seen. Genus Trichomonas has 3 species which occur in human. The three species and Trichomonas vaginalis. History and distribution. Trichomonas vaginalis was first observed by Don 1836 is vaginal secretion. Prevalence of trichomoniasis varies from 5% patient at hospital to 75% in sexual worker. And morphology. It is pear shaped or oval and measure 10 to 30 mm in length and 5 to 10 mm in width, with a brief undulating membrane reaching up to the carrier center of the body, its 4 anterior flagella and 5th running along the outer margin of the undulating membrane, which is supported at its base by a flexible rod costa. A prominent exostyle run throughout the length of the body and projects posteriorly short of a tail. The cytoplasm show prominent siderophilic granules, which are most numerous alongside the exostyle and costa. It's motile with a rapid trajectory and switching touching tape movement. Habitat. In female, it lives in vagina and cervix and should even be found in Proteins glands, urethra and bladder. In male, it occurs mainly within the entire urethra but can also be found within the prostate and preputical sac. Mode of transmission. The trophozoite cannot survive outside, then infection has got to be transmitted directly from person to person. Sexual transmission is that the usual mode of infection. Trichomoniasis often coexists with other sexual transmitted disease like candidiasis, gonorrhea, syphilis, or human immunodeficiency virus. Babies may get infected during birth. Fomites like towel are implicated in transmission. Trophocytes divided by binary fission, and as cysts are not formed, the trophozoite itself it is that the infective forms. Incubation period is roughly 10 days. Life cycle. Life cycle is Trichomonas vaginalis is completed during a single host, either male or female. Pathogenesis. The vaginalis particularly infects epithelium and not columnar epithelium. It secretes cystine, protests lactic acid and ethanoic acid, which disrupt the glycogen label and lower the pH of the vaginal fluid. It is an obligate parasite that and cannot live without close association with the vaginal urethral and prostatic tissues. Parasite cause pedicle hemorrhages, strawberry mucosa, metaplastic changes, and squamation of the vaginal epithelium. Intercellular edema, then called chicken-like epithelium, is the most characteristic feature of trichomoniasis. Clinical features. Infection is usually asymptomatic, particularly in male, although some may develop urethritis, epididymitis, and prostatitis. In female, it's going to produce several pruritic vaginitis with an often offensive yellow green, often discharge, dysuria, and cervical erosion in common. Endometritis and pyosalamingitis are infrequent complications. Rarely, neonatal pneumonia and conjunctivitis have been reported in infant born to infected mother. The time period of trichomonasis is 4 days and to 4 weeks. Laboratory diagnosis. Microscopic examine. First, vaginal or urethral discharge is examined microscopically in saline wet mount preparation for characteristic of twitching, motility, and shape. In male, trophozoite may be found in urine or prostatic secretion, and fixed smear could also be stained with acridine or orange and pepnicolloy and James stain. Direct fluorescent antibody is another method to detection of parasite and is more sensitive than the wet mount. Culture. Culture is suggested when direct microscopy is negative and is taken into account as a gold standard, also as the most sensitive 95% method for the diagnosis of Trichomonas vaginalis infection. It grows best at 35 to 37 degrees Celsius under anaerobic condition. The optimal pH for growth is 5.5 to 6. It are often grow during a short of solid or liquid media, tissue culture, and eggs. Cystine peptone liver maltose CPLM medium and plastic envelope medium PEM are often used. And serologically, ELISA is employed for demonstration of Trichomonas vaginalis antigen in vaginal smear, employing antibody for 65 kDa surface polypeptide of Trichomonas vaginalis. And molecular method, DNA hybridization and PCR also are sensitive 97% and specific 98%. Test for the diagnosis of trichomonasis and treatment simultaneous treatment of both partner is suggested. Metronidazole 2 gram orally as one dose or 500 mg orally twice each day for 7 days is that the drug of choice. In patient not responding to treatment with standard regime, the dose of metronidazole could also be increased, or it may be administered parenterally. In pregnancy, metronidazole if safe in second and third trimesters. Thank you.